This is your first mini lecture on Chapter 1, Your Career in Healthcare. Take notes as we move through this. This will help as you study for the exam. You've chosen a great field. Healthcare is one of the largest industries in the United States with a growing need for healthcare professionals. Not only that, there's a wide variety of career opportunities, and your work can be very fulfilling. This is often what attracts students to careers in healthcare. They want to make a difference in the lives of their patients. You also have to keep in mind, however, that working in healthcare is very demanding. You must take your work seriously because it affects the well-being of others, and your tasks must be completed accurately because a mistake can be devastating. That being said, there are 7 essential qualities of healthcare professionals. You'll be reacting to these after this mini lecture. Healthcare professionals must care about others, have integrity, they must be honest. Healthcare professionals must be dependable. Your coworkers and your patients are depending on you to be on time and to complete tasks as expected. Healthcare professionals must work well with others. This is something we'll practice in this class. You must be flexible. You'll often have to change tasks, change focus, and you must be able to do that. Healthcare professionals should be willing to learn. We're constantly updating our knowledge base. And finally, healthcare professionals must be cost conscious. This is a field in which we need to make sure that we're working efficiently and we're aware of costs. Now, as we look at the healthcare professionals, we need to understand that there are standards that have been set in terms of training and testing to protect the public from potential harm by incompetence. When you go into the healthcare system, when you're seen by a healthcare professional, you need to be able to be certain that they are well trained and they have what it takes to take good care of you. So standards are very important, but standards differ from one profession to another. So let's first talk about certification. Certification is a more general term for meeting these predetermined standards. This requires a certain level of education and taking a professional exam. And you see before you a few professionals that are certified: the medical assisting, the CNA, the occupational therapy assistant. Registration is a bit different. Registration is placement on an official list after meeting predetermined standards, which include education and testing. A nurse is a registered nurse, a registered respiratory therapist, a registered dietitian. And then there's licensure. This is designation giving permission for a person to legally perform certain tasks. It's usually granted by state governments, and requirements can differ from state to state. So as you look at your profession, and this will be something that you'll be working on throughout this semester, it's important to understand what standard is required and what is required to meet that standard. So besides the requirements such as professional exams, other requirements may include completing a high school degree, completing specific coursework, successfully completing clinical education, and not having been convicted of certain crimes. That's something that you want to look into early. If you do have a criminal record, you need to make sure that that will not block in the future your pathway to your chosen profession. By the way, Single Stop, which is an office on campus, has expungement clinics in which they have individuals there to help you clear your record. So now we're going to talk a little bit about career ladders. These are levels of occupations within a professional field. They require different amounts of education and training. It's important when you're thinking about a certain career to understand the career ladder, because that will help you make a good choice about the specific career that you're well suited for. So for instance, career ladders involve education, the amount of time you have to devote to your education, your natural abilities, the types of activities you enjoy most, and preference for the type of work environment. These are questions you should ask yourself, because not only will these questions help you choose a career, but also the level within that career in which the work will be most satisfying and fit you best. This is an example of a career ladder, from the CNA to the LPN to the registered nurse to the nurse practitioner. Now, there is an increase in education and responsibility and salary with each step, but it does not mean that the top step is the step that is the best fit for you. I've met students who feel that they are most well suited to be a CNA and not a registered nurse. You need to think about the characteristics of that specific job and how it fits you best. So before we close up our mini lecture, we're going to look at career categories. This is something that you should understand. It's a way of sorting different careers. The first career category is therapeutic and treatment occupations. If you want to work closely with the patient, kind of hands-on, these careers may be best for you. There are a list of different careers, and they do differ quite a bit, but you see with each of them, you're working very closely in terms of patient care. When you do your career search in this course, you need to make sure that you look at many careers within the specific category that you think is best for you. Now, diagnostic occupations are different. Diagnostic occupations help to identify or determine the causes and extent of diseases and injuries so proper treatment can be given. They might monitor patient progress. So these careers fit people who are very investigative. And there are a number of them. So if you feel that you're investigative, you like to figure things out, any of these careers may be a good fit. You'll also notice that within the category, there's a lot of variety and the careers can differ quite markedly. The next category is health information management. Any healthcare system produces lots and lots of records and data, and someone has to help manage that data. So if you are comfortable around computers and like to work with data, these careers may be good fit for you. These careers are growing rapidly because of the electronic health records that healthcare facilities are increasingly using. Finally, there are the environmental occupations. These individuals maintain the environment of the healthcare facility. So whether that's providing food, cleaning, managing resources, these individuals are very, very important. And again, there's quite a variety of careers here. You may see something that you like. By the way, we do have a biomedical engineering certificate and program here on campus. That's the end of the mini lecture. What you'll do next is your response.